Hi everybody. My name is Shara Reiner, and I am a nurse that deals with stem cells and cord blood. And we are interviewing the amazing Dr. Alex Melhuish from Vitalia 24 in Antalya and Istanbul. And we're going to discuss today treatment for ASD and long COVID. Wow, for children and adults in Turkey. How are you, doctor?
I'm great. Thank you so much for inviting me to discuss exosomes and stem cells.
Great. So let's dive right into it. You've been a doctor for quite a long time and you have an impressive record, but we want to know, what can you do for our patient?
We generally concentrate our treatments on neurodivergent and neuroinflammatory patients in Istanbul. In essence, ASD. In Antalya, we concentrate more on long COVID and the effects of long COVID. It's two different types of setup, but they're both in a hospital setting. Our ASD patients, they're always treated in Istanbul in a large hospital.
Okay, so let's say I want to bring my child to you, and I have lots of autistic children in my house. What do I need to do? What is the first thing that's important for you so we can start the process?
The first thing, as always, is to make contact and send us whatever relevant medical information or data that you have, at which point the medical team will evaluate and get back to the parent and generally ask for a little bit more background information before setting up a teleconsultation, at which point both the parents have a chance to ask any and all of the questions that they have, and also the medical team, so they have their own set of questions anyway. After the preliminary teleconsultation, our medical staff meet again and then come to a decision with a yes or no. Can we or can we not provide a treatment? Or at which point, if it's a yes, we have a follow-up teleconsultation, at which point details and plans are made.
Great. So in my medical file, what is important for you to see?
Good question. In the medical file, the medical team, especially for the ASD patients, always like to see what kind of continuous physical and educational therapy that the patient or the child may be having at that time. That's very, very important for us because that indicates that the treatment will have a better prognostic effect in conjunction with continuous education. And also, somewhere an official or formal diagnosis of ASD or ADHD, for example, generally by the psychiatrist or pediatrician or by the school board themselves.
And what happens if my child has other medical conditions? Do I need to have a letter from a specialist as well?
We always like to know about all other medical conditions. Those are taken into account, and depending on what the child has, the different member of the specialist medical team will ask if they need any more extra information.
So I've given you your medical file and you've gone over it and you've spoken to the patient's parents, and doctors say that we are eligible. And we had a consultation afterwards, which you explained what's going to happen. And now we are on a flight landing in your country. What is happening from now?
You'll be met at the airport by a representative of the hospital, and then taken to your prearranged accommodation. Generally, patients prefer to come a couple of days before to settle in. On the day of treatment, you'll be picked up again by our taxi concierge service and taken to the hospital, where you'll be met at the entrance by one of the patient representatives and taken to your private room. Of course, there's a lot of paperwork on the first day, a lot of informed consents and administrative signatures to be taken. Beforehand, during our first and second consultations with the parents, we generally have a plan in motion already. For example, some children find it very traumatic having a blood draw or sitting down. So this is discussed well beforehand. In cases like this, where the patient will need to have some light sedation to be able to do the blood draw and give the IV treatment, we request that the child doesn't have anything to eat for 6 hours before. If, for example, the patient doesn't need sedation, then the IV cannula is placed. We give a little bit of sedating syrup to make them a bit sleepy so they can sit either on the bed with their mum and dad in their arms, or they can even sit on the comfortable couch or chairs that are provided in the room and watch TV while they have their IV treatment, which will last about 10 to 30 minutes, depending on the veins of the child and how comfortable they're
Again,
lying. The IV access is opened, and both infusions of exosomes and mesenchymal stem cells, they take anything from 30 to 50 minutes to complete. After that, there's a short observation period, about an hour after treatment. And then the IV cannula is taken out and they're discharged from the hospital on that day. The procedure is repeated on day one, day two, and day three. On all 3 days, they'll have IV treatments of mesenchymal stem cells and exosomes. Our mesenchymal stem cells are umbilical cord derived mesenchymal stem cells. And for autistic patients, for example, we calculate the dosaging based on their kilogram, on their weight. The same with the exosomes. The third day of treatment, or the final day of treatment, they're also given a supply of intranasal exosomes, about 7 to 10 billion, where they'll continue their treatment at home within a home setting. Each intranasal exosome application lasts anything from 7 days to 10 days, but it's 7 days full dose.
so this is a process, and now we've done it all, and we are going home. What happens in the next 6 months?
Well, we have a 10-day, 1 month, and 5 month follow-ups always scheduled. This is to record the improvement over time, and also to follow up where we can see where certain activities or educations have a dramatically synergistic effect with treatment. The patients, this is the other reason why beforehand, if you remember before I discussed, we're always more inclined to treat patients that are within a educational system where they have daily or even every 2 or 3 times a week speech therapy, cognitive therapy, occupational therapy. There are all types of other therapies, including water or hydrotherapy. These are all to stimulate the brain, because at the moment, as soon as we give the exosomes and mesenchymal stem cells, you will see a change in attention and concentration. They're both slightly different things, but concentration and attention will be dramatically improved at that point, at which point we need to help the child understand what they're seeing and what they're hearing, all this new information, all this new understanding that they'll have. If not nurtured and elasticized by continuous education during this very essential 6 months period, they can become very insular again. So one of the most important aspects of mesenchymal stem cell exosome therapy is the fact that especially in ASD and children, is that they continue there or have more speech therapy, occupational behavioral therapy, and they have a good homeschooling as well in that case. We also provide educational materials as well as part of the exit package.
Amazing. So we've done all this, and it's amazing. So what we want to know is what we can do to help patients get to you, to help you, everybody. You can only click on the link below this video and receive all the information you need from the amazing Dr. Alex. Thank you so much for being here today, giving us this very important information and supporting autistic people and autistic children and families in progressing towards a brighter and healthier future. We'll see you all on the next video. Goodbye.
Bye bye.